Hello, I am Dr. Efe, current intern in obstetrics and gynecology in Edo State Specialist Hospital. So I'm going to be talking about the risk factors for cervical cancer. The risk factors for cervical cancer are well known, so we all need to be aware of the risk factors because knowing the risk factors can help with the prevention of this cancer. So the risk factors include the human papilloma virus, known as HPV. Now, HPV is a very common infection in women in reproductive age group. So women that have sexual experiences. So now HPV is very common, and there are some certain strains or types of this HPV virus that cause cervical cancer. So we all need to be aware of that. Some other risk factors for cervical cancer are multiple sexual partners, sexually transmitted infections. So these go hand in hand. The sexually transmitted infections, what they do is when you have one sexual transmitted infection, it's a background for more infection. So one leads to another, chlamydia, gonorrhea, makes you susceptible for human papilloma virus. Also, another thing that sexual transmitted infections do is they reduce your immunity. So you can tell when you have a decreased immunity, the body has to do a lot more work to fight the human papilloma virus. Some other risk factors are smoking. A lot of people smoke these days. You think the smoking only affects the lungs, no? Smoking affects every part of your body, all the organs. It makes you susceptible to more infection and reduction in the body's ability to clear the human papilloma virus. So now, how can you prevent yourself from coming down with this cancer? Now, knowing the risk factors, multiple sexual partners, sexually transmitted infection, smoking, and the likes, as well as this human papilloma virus, one, you can reduce your number of sexual experiences. Reduce your number of